Hi, it's Dr. Matt Russell from Vizon. If you're considering PRK in this video, I'll answer the question, what are the risks of PRK? PRK is a very safe vision correction procedure. The risks of PRK are exceedingly small. The most significant risk is a delay in healing of the surface of the eye. Healing of the surface of the eye can occur usually within 2 to 3 days. For some patients, it may take several days or up to a week to completely heal. And in this situation, you'll need to wear a bandage contact lens on the surface of your eye, and it may slow your ability to get back to your routine day-to-day activities such as work and driving. Dryness is a very common side effect of laser, and almost everybody will suffer from some degree of dryness. It'll affect individuals quite differently, however. It's common for dryness to cause some blurring of the vision, fluctuation of the vision, and it may even cause a sense of tiredness of the eye towards the end of the day, particularly if you do a lot of computer work or reading. Dry eye is most prominent in the first 4 to 6 weeks after the surgery. After 4 to 6 weeks, however, most patients notice that week by week that the dryness is improving, and they're slowly reducing the frequency that they put the drops in. Almost everybody has recovered from dry eye symptoms by 4 months after surgery, and there's a small group, perhaps 10%, that have symptoms that last 6 months or longer. Almost all of these patients will completely recover from their dry eye symptoms, and it's rare to have persistent dry eye that lasts longer than 12 months. Haze is a side effect that can occur after PRK treatment that is not common after LASIK treatment, and haze will affect the quality of vision in approximately 1 to 2% of patients. Patients are still able to see quite well, but they notice glare from headlights, and they just feel that the vision is not quite as distinct as it should be. Most cases of haze can be treated with anti-inflammatory drops, although these may be required for several weeks in order to control the haze-producing process. Some cases of haze may require additional laser treatment to correct. Perhaps the most concerning risk of PRK is the very rare risk of infection. Approximately 1 in 15,000 patients will have an infection that may cause a mild degree of scarring on the cornea that could cause a reduction of 2 lines of best possible vision in the eye. And that would mean that if you started with vision, as most people do, of slightly better than 20/20, say 20/15 vision, that the vision would be reduced to a level of 20/25. This would still be very good vision compared to the vision that you started with without glasses, but not as good as you were able to achieve in the best possible glasses before treatment. Most scars can be treated with additional laser treatment. There are very rare cases in which an infection may progress from mild to moderate to the level of severe. The rate of severe infection is approximately 1 in 30 to 50,000. This is a very rare event, and the best way to avoid this is to regularly take the drops as prescribed, and if any symptoms of infection occur, to have these assessed by your treating doctor as rapidly as you can. Catching the infection at an early stage will usually lead to good preservation of the vision. The best way to know if you're a suitable candidate for LASIK or any form of vision correction we offer is to book a free laser vision assessment. You can book the appointment directly on our website, or you can call us if you prefer. You can even scan the QR code you see on the screen right now, which will link you directly to our online calendar where you can choose a time and date that suits you for a free initial assessment.